Once again, today I'm going to talk about the process of fertilization and the main cells type of this female reproductive system. First, there is a video about anatomy and physiology, but we are going to talk about in deep the internal genitalia and the external genitalia and its parts. First of all, we have the vagina, we have the ovary, we have the uterus, the cervix. I'm going to talk about the vagina anatomy and physiology. And the vagina, we have anatomy, we have vagina and the outer of it. What is the role of the vagina? Vagina is the birth canal for a child. So let us talk a look about how the child is formed. So a male meets with female. So in that case, sperm meets with sperm meets with egg produced by the ovary. But in that case, the fertilization is occurring, but that the release of the egg from the ovary is released at the ovulation phase. Is released at 14th day, which is the average between 0 to 28 days, and 28 days is just the average. The normal of the menstruation phase can take us up to the 21 up to 35 days. And when you make an average, we are going to make an average. You take 21 days, you add 35 days, you get 25, 21, you get 56. Then you divide by 2, which is 28 days. So 28 days is just an average. So we have ovary, vagina, cervix, and uterus. So how the baby is formed? At the 14th days, the sperm meets with egg, and with egg is from the ovary, and that egg is carried to the fallopian tubes via by finger-like projections parts of the fallopian tube. Then the zygote is formed and then divide in total 16 cells. 1 cell, then 2 cells, then 4, then 8, then finally to 16 cells. It undergoes cell division. So apart from that, we may have some abnormalities, but we discuss there just after. For regarding the plantation will occur between 7 to 9 days in of the uterus, of the zygote in the uterus, and that zygote becomes embryo during between 2 to 8 weeks, total 4 weeks. That embryo is continue to grow, and during the first trimester, organ will be formed, and the child will be formulated. So the pregnancy takes 41 weeks, 40 to 41 weeks, the normal pregnancy. But we can have what you call preterm labor or post-term labor. Can have what you call pre-rupture of membrane or preterm pre-rupture of membrane. That is prom or pre-prom or less than gestation or fetal fundal less than gestational age, which indicate intrauterine fetal growth restrictions. So, but that will be discussed later. Let us focus on the anatomy and the physiology of the vagina. So we have what we call ovary. Ovary is a part of the female reproductive system of internal genitalia. That is the internal genitalia. Internal genitalia is made up of ovary, of uterus, of cervix, fallopian tube, vagina, vagina. Then we have 2 ovaries with 2 fallopian tubes, and we have fundus, we have endometrium, myometrium, and perimetrium. Those are 3 parts which surrounds the one. Endometrium is protect the baby. Myometrium is for construction. It contains Braxton Hicks contraction, which are the contraction which are there, but are not at the highest level of contracting. The normally myometrium start to contract during the onset of labor. Regular contraction starts. Then uterus is where it is the site of implantation. Sometimes implantation can be inside the uterus. No, can be outside the uterus. When implantation happens inside the uterus, is in the normal pregnancy, but outside the uterus, such as in fallopian tubes, is what you call ectopic pregnancy. When you are a nurse at the hospital and or a midwife and the suspect, and which indication can you depend on suspecting that someone is having ectopic pregnancy? Abdominal pain, vaginal bleeding, and sometimes epigastric pain. So, for regarding ectopic pregnancy, what can you do? Is to monitor fetal signs, monitor fetal growth, monitor fetal life, fetal signs such as fetal heart rate, and if no fetal distress, you can if possible plan for delivery. If it is a premature birth, it is a birth less than 37 weeks of gestation age. If it is a premature birth, you can give dexamethasone so that the baby will born prematurely, so as it will prevent lung maturity. So during before the duration for pregnancy is 40 to 41 week, and should as a woman underwent 8 ANC visits. ANC means antenatal care. ANC visits means antenatal care visit. That is the care it is the visits before giving birth, antenatal. So the other part of the ovary contain is where it is the site where eggs released from a fallopian tube. We have a uterus, we have the cervix. This is a very main important part, because during the stage of labor, first of all we have the cervical dilatation, then irregular contraction, the concept of uterine contraction and the cervical dilatation. When cervical dilatation is fully dilated, the baby started to move, because during the delivery process, normal SVD means spontaneous vaginal delivery. SVD means spontaneous vaginal delivery. So during the spontaneous vaginal delivery, first of all, you must do what we call the vulvar dissection, so that the baby and you be supporting perineum, so the baby will not harm the perineum, and the perineum will not be broken, and the baby will not get in contact with the poor hygiene outside, that is on the vulva. So vulva, what is the vulva? Vulva is all external genitalia parts of the female reproductive system. So we have uterus, cervix, and the vagina. Other is the cervix. The cervix is given during the induction of labor. Can put urinary catheterization in the cervix, induce labor by that. Cervix is very important because it is where baby passes through during the delivery process. Baby comes from uterus, and there is other main important part of which develops when the mother is pregnant. That is called the placenta. The placenta is there to allow nutrients to pass through the mother and the baby, and the uterus exchange those nutrients from the mother to the baby. So we summarize that the parts of ovary, uterus, cervix, and the vagina. Vagina, it is 1, 2, 3, 4, 5, 6, 7. You have 7. Before reaching the cervix, you must count 7. You must put a hand in the vagina, your hand in the vagina, and then count 7 centimeter. 7 centimeter. Then you reach the cervix. Then you do vaginal exam. You should not do vaginal exam consistently. You do vaginal exam as indicated, and when it is when it is necessary. Uterus, ovary, cervix, and the vagina. That is the external genitalia part.